I was introduced to medicine very early. My father was a physician. He was a pulmonologist and an allergist. And so as early as I can remember, I was exposed to medical stuff. I mean, my brother, older brother and I, we would go to the hospital with Dad when he had to go in at night, and we would stay in the physician's lounge and kind of hang out there, try to find cookies and things while he was seeing patients, and then he would come back and find us. And of course, one night we thought we got onto what was a rudimentary computer program. Of course, this was now in the 1970s or earlier. And all of a sudden it started beeping and blaring loud noises. So we thought we had broken it, and of course ran to the other end of the physician's lounge. Of course, it's 8 o'clock at night. There's nobody else there except my brother and I. So I was introduced to medicine very early, and I would go to the hospital with my dad when I became older, and would actually walk around with him and see patients on rounds. This is well before the days of HIPAA. And even though he was an internist, one night I went in and he did an emergency tracheotomy on a patient along with an ORL surgeon, and I got to go into the operating room and sit up top in the theater and watch this all happen, and it was very exciting. And one day I went in and he was again rounding on his patients, and he had to do a thoracentesis on a patient who had a malignant effusion. So this is where there's cancerous cells in the chest, and it's creating so much fluid in the chest that the gentleman couldn't breathe. So Dad just very quickly did a thoracentesis there at the bedside. I got to hold the needle and do things. And of course, this is before, you were supposed to wear rubber gloves and all that. And I just remember some of it dripping across my hands. And then 10 years later, I realized, I didn't even have gloves on then. But that's the way it was. And so that was my introduction to medicine. And so it's been interesting. So one thing that's very different about infectious diseases than many of the other medical disciplines is that we work with a completely, well, let me put it like this. The drugs that we use are not designed for people. They're designed for viruses, for bacteria, for helminths, for worms. And so we're constantly dealing with a whole nother biomass in the world, in a sense. When you see somebody for hypertension or high blood pressure, the medicine you get was designed to work in your cells to lower your blood pressure. If I see somebody, say for HIV, I have to think about, their immune system, the antiviral drugs that we use are not designed so much for the person, they're designed to be safe, but they're designed really to kill a virus. And then we also have to take into account where people have been. We have to understand their history. Have they traveled anywhere? We look for occupations. We look for all sorts of exposures. And so in a sense, one of the defining characteristics of infectious diseases is we have to keep a very open mind to what's happening. What's happening around the world? Is there a new outbreak of, say, drug-resistant malaria that we need to know about, because we see travelers here in Oklahoma City who have malaria. So we need to know these things, and it always keeps you on your toes. So a typical day, I would give you a couple of different typical days. So there are the days where I'm doing hospital duty. And when we're on hospital duty, so to speak, or seeing patients in the hospital, I work with fellow, with residents, with students, with some very excellent PharmDs also. And our job is to see patients that other physicians have asked us to see who have or have suspected to have some kind of infection. And so these can be folks who, say, just come in through the emergency room with, say, an abscess in the leg and have bacteria in their blood from that. So they can be, in a sense, normal hosts or immunologically normal hosts. We also see a lot of people who we would say are immunologically not normal hosts. These are people who are on chemotherapy, say for cancer, who have transplants from, say, a liver transplant or a kidney transplant. or perhaps they have rheumatoid arthritis and they're getting medicine to control their underlying arthritis. All these agents that they get, the medicines, they suppress the immune system. And so it makes them susceptible to a whole different range of infectious diseases than what somebody who's not on those, who has a normal immune system, has. So we really see a very wide spectrum of different kinds of infections. We see post-surgical infections, traumatic infections, you name it, we see it. We often joke that half of what we do is Staph aureus and the other half is everything else, but that changes with the week. Infectious diseases, like many other aspects of medicine, is highly interdisciplinary. The folks that we work most closely with are folks out of pharmacy, so they have PharmDs. We have some absolutely phenomenal PharmDs in our group. Some of them are specifically infectious diseases PharmDs, and so they work with us in the hospital, where we design optimal antibiotic regimens for folks. We look for drug-drug interactions. They help us a lot with the outpatient antibiotic therapy side of things. We also have some excellent PharmDs who work with us in our HIV clinic that are specific experts in HIV and HIV drug management. So I would say PharmDs are clearly one of the top folks that we work with. Another group are folks in clinical microbiology. And here on campus, these are folks who have appointments in the Department of Pathology. They're also MDs, but sometimes they're PhDs. And they are the ones that we interact with, looking for different types of culture results, susceptibility testing, different techniques. If we need something special done, they're the ones who we work with to figure out what that special sauce is that we need to help make a diagnosis. So I would say those are the two main ones that we work with on a daily basis. Folks that I've been working with a lot over the last 2 years are in epidemiology at the Hudson College of Public Health. We have some absolutely excellent infectious diseases epidemiologists there. And so, as you can imagine, with the pandemic, that has been a major emphasis in my life. Other infectious diseases folks work a lot with infection preventionists and work in the hospital to prevent infections. And so there's a lot of different things that we do. In the laboratory, I tend to work with PhD immunologists and folks in geriatrics and study brain inflammation. So it just sort of depends on the day, but we do work with a lot of different folks. Well, I am not making this up. The first career field that I considered was professional football. And I remember very distinctly, I was a big Kansas City Chiefs fan. Okay, I grew up in Wichita, Kansas. This was back in the days of Lynn Dawson. And I remember watching the Chiefs one day, and I don't even think that I knew that they were wearing shoulder pads. I think I must have been about 5 or 6 at the time. And up to that point, I wanted to be a football player. And I remember watching them one day. I said, those guys are awfully big. And I said, I don't think I'm that big. Well, I guess I'll be a doctor instead. And so that was pretty much it. So I considered 2 things in my life, professional football and medicine. And, if you could see me, there aren't that many 5'8", 165-ish, 170-pound professional football players out there. So I probably made the right decision there. In terms of what to go into in medicine, that was a little more difficult. I had a lot of different interests. At one point, I thought I would go into orthopedic surgery, and that was after I had a fairly severe knee injury playing high school football. And I was so impressed that the surgeon could put back together my knee. I had 2 torn ligaments and a ruptured cartilage, and then I could go on and play football in college. And so for a long time, I thought, well, gee, I want to go into orthopedic surgery. When I got into medical school, things changed a bit, and I ended up going into internal medicine just because it seemed to work for me better, and then found my way into infectious diseases. And so I think it's an interesting journey in what you do, and I think you just have to be open to the experiences that you have. You have to be open to understanding yourself in a new light, because as you age, you change. I was obviously aged between when I was 5 and considering professional football to when I was 16 or 17 and thinking, only about football from a high school level to eventually in medical school and residency. And then, as I mentioned before, my time at the London School of Hygiene and Tropical Medicine was indeed formative. So that's the story, and I'm sticking to it. So obviously you can't go wrong specializing in infectious diseases, unless of course it's just not for you. And if you take a historical view, probably some of the first infectious disease specialists were actually surgeons, because when you think about it, antibiotics have been with us less than 100 years. The ability to surgically open an abscess and drain it has been around for probably thousands of years. So take a broad view. As you're going through your studies, get to know yourself. When you look at what you do, obviously you want to do things that you're interested in. So you have to have that passion or interest. That's important. But I don't think it's the only thing. You also have to show an aptitude for whatever field you're looking into. For example, if you want to be a surgeon, and my son is a fifth-year surgery resident, he has an aptitude with his hands that I never had. And so you really have to understand that and honestly think about yourself. What is it that you're able to do and able to do well? And so you want to have that along with your passion or your interest. And lastly, I think the third question that you want to look at is, what does the world need? Where is there a need for you? Another way to look at that is, what's the market for your skill, if you're taking a market-based approach? Or you can look at it, as I said earlier, as a needs-based approach. There are some things that the world really doesn't need more of. Say politicians who don't tell the truth, for example. We really don't need any more of that. But there are a lot of healthcare needs that we really do need. And so you can take a look at those three things. What does the world need? In a sense, what's the market? What are you really interested in? And what are you skilled at? And often that's an exploratory process. And so my advice would be, don't shut yourself off too soon. I mean, I was always constantly in danger of doing that I was saying, well, gee, I want to be an orthopedic surgeon. Boom, that's what I'm going to do, without really understanding much of what went into it. And of course, I've had several orthopedic surgeries now on knees and shoulders, and I really value good orthopedic surgeons, but I just don't think I could have been a good one. So I'm satisfied with where I ended up, and it's been able to help me stay intellectually curious for the last 20 or 30 years in the laboratory. And then another thing that's interesting about infectious diseases is that you get to see and deal with things that are completely new. Often there are things that you wish you didn't have to deal with. And for example, we're dealing with COVID-19 now. This was a new phenomenon in a sense. I mean, pandemics have been around for a while, but this was a germ that we really did not have innate immunity against or any kind of pre-existing immunity. So in that sense, it was new. It was new to us as a species. So keep an open mind, get to know yourself, and be perceptive about what's going on in the world. Healthcare is a noble profession, and even when you have a bad day, at least things can be difficult, but at the end of the day, you know that often you're making a difference for good in somebody's life, even if it's a small thing. And I think that's one thing that healthcare offers to folks that many other disciplines don't. And that, it's a huge economy, and there are many very important jobs. And we shouldn't denigrate any jobs. For example, the folks who clean the floors in the hospital, they are incredibly important for preventing infections. If we didn't have clean floors and clean sinks in the hospital, you wouldn't want to go there, I wouldn't want to go there. And you can literally count the numbers of people who would be negatively impacted by that. So you never want to denigrate any job per se, particularly if it's done in a way that folks are doing it to the best of their ability, and you can see how it fits into the larger scheme of things. So I guess the last piece of information would be that healthcare is a great field. It's a needy field, and often you do feel the strain of that. But at the end of the day, you do know that you're making a difference, and it can be a positive difference. And for me, that's important.